Now, in order to get a true appreciation of the outcome of this particular study, which was a randomized, double-blind, placebo-controlled trial, we really have to start looking at the outcome to start with. Now, here we have depression scores, I believe the PHQ-9 Personal Health Questionnaire. Now, check this out. Look at the top. Keep in mind, this is doing nothing more than 1,500 milligrams of a curcumin extract over a 12-month period of time. Look at the PHQ-9. Look at the difference between, for example, those which had moderately to severe depression, and look how that group emptied out. Then look at the group that had moderate depression, and look how that group began to empty out as well. And of course, going from bottom up, you had more mild, less moderate, less severe. So that is pretty amazing. Now, that's the tip of the iceberg. Now, the interesting part about this one particular study is the researchers admitted there could be a limitation in regard to some confounding because of the other outcomes being so spectacular. And you're ready? Now, let's look at the next one. Check this out. All right, look at this. Look at the elevation of serotonin levels after 12 months. You notice how the placebo group is pretty much, flat along the line throughout the entire year. But look at the increase in the curcumin group. This is what we have to start with looking at the outcome. Or I should say secondary outcomes of this particular study. Now, look at the glucose, which is ideal, which is perfect. But that's still not even the most spectacular part of the study. You ready? Here we go. Check this out. Next page. Boom. Look at the RAND cell. All right, the RAND cell here is your glutathione peroxidase. Check out the increase in the glutathione levels after 12 months by doing nothing more than the consumption of curcumin capsules or an extract. And more than doubled. All right, now check out the superoxide dismutase levels, all right there, called RAND-SOD. All right, look at the increase. Now, again, what's really weird, look at the placebo group. It actually went down after 12 months. But look at the curcumin group. Look at that dramatic increase. You see where you can have some confounding because all these factors play a role in improving the health outcome of the individual, and they begin to feel better because they feel better. You get it. All right, BMI. Look at the drop. Again, doing nothing more than consuming 1,500 milligrams of a curcumin extract, no particular brand or type, it's just one that they developed, or through an ethanol extraction through dry powder. And then at the same time, look at the body weight drop in kilograms. And that's where you notice they're going, well, there's so many positive factors in the consumption over a 12-month period of time, they have to look at the entire picture. But still, just the same, it is freaking spectacular. Let's get right into the study as follows. Curcumin reduces depression in obese patients with type 2 diabetes, a randomized controlled trial. Again, the study employed a randomized, double-blind, placebo-controlled trial with 227 participants. All right, here's the methodology. I just wanted to bring that up in the beginning to make sure it's nothing that's not insurmountable. All right, they totaled 6 capsules per day. Each capsule was about 250 milligrams apiece. So you get the picture over a 12-month period of time. All right, if you want to look at how they manufactured the ground powder, the curcuminoids content, and how it's encapsulated, that's what it is. Nothing particularly special in regard to the manufacturing of the capsule for this particular research group. It was pretty basic. Now the backstory. All right, previous randomized clinical trials have indicated that curcumin at doses ranging between 250 to 1,000 milligrams per day over 10 to 12 weeks may be beneficial for managing anxiety and depression. Remember, this is the backstory. Particularly in obese individuals with type 2 diabetes patients with a major depression. Despite these encouraging results, the number of randomized clinical trials investigating the effects of curcumin on depression in this population is limited, and existing studies have notable limitations. Therefore, the present study aimed to assess the efficacy of curcumin supplementation in improving depression severity among obese type 2 diabetic patients. Quoting, We focused on increasing serotonin levels. So this is the interesting route that they took. A lot of people didn't recognize that depression may be associated with neuroinflammation. So let's proceed forward. I don't want to add publisher bias. We focused on increasing serotonin levels through the anti-inflammatory and antioxidant effects of curcumin. The evidence-based, double-blind, placebo-controlled trial was designed to evaluate the feasibility of using curcumin as a therapeutic intervention. All right, here we go. Primary highlight. The improvements in anti-inflammatory and antioxidant parameters likely contributed to observed elevation in serotonin levels within our curcumin-treated group, leading to a reduction in depression of severity. Conventional antidepressants, while effective, can induce weight gain by affecting neurotransmitters such as serotonin, distinct part, and histamine, which regulate appetite and metabolism. In contrast, our study demonstrated a significant reduction in body weight and body mass index in the curcumin-treated group, potentially linked to the enhanced insulin sensitivity, improved glycemic control, and decreased cardiometabolic risk factors like inflammation, so on and so forth, some of the secondary outcomes which we covered. Additionally, quoting, we observed a significant reduction in BMI in the curcumin-treated group. The effect of curcumin on lowering BMI may vary. However, our understanding of its effectiveness in achieving lower BMI levels is incomplete, and further research is necessary for a comprehensive understanding. Quoting, and this is part of the confounding limitations they may have alluded to. To proceed, it may be possible that in some cases, significant weight loss may have led a positive or had a positive effect on the depression severity. However, we do not have any direct evidence to support it from our study. To conclude, curcumin supplements exhibit potential antidepressant effects on type 2 diabetes patients with obesity by elevating serotonin levels, reducing inflammation, and mitigating oxidative stress. Quoting, our study demonstrated that curcumin may effectively alleviate depression severity in this population. And wow, all I can do is take a little bit of tidbit to grab your interest in regard to the full study itself. A wonderfully conducted, high-quality study in a relatively large population group. But wow, you're looking at the primary outcome. All right, everyone feels better. Great job. I should say without any publisher bias. Most people feel better. Yes, great job. However, the secondary outcomes, reduction in inflammation, increase in serotonin, better glycemic control, drop in body weight, reduction in BMI, increased glutathione peroxidase levels, and superoxidase dismutase, just skyrocketing like that compared to the placebo, and the p-value, the significance of the outcomes was just extraordinary, like 0.00001. An amazing significant outcome overall. Again, you have to give gratitude to the researchers. Phenomenal. Nothing out of the reach of the ordinary consumer as far as working with a medical professional. Incorporating something like this, they gave the whole methodology in regard to the reduction. I didn't see the binders and fillers, but you got the idea. But wow, it is just really amazing. Again, gratitude to the researchers. I am humble you watch. Look forward and see what you and I both discover next week. All right, I'll catch you all next time. See you then. Bye.